we know your research about urology and the new part in the new textbook of Smith's Urology about kidney stones and cancer researches. First, I want to ask you, what is prostate cancer?
Prostate cancer is the most common cancer seen in men, and usually it's seen over 6-year-old patients. But this not mean that it is not seen in the younger age. Yes, we know that it can be seen between 40 and 50 years of age man. And if this disease is seen in the younger age, the course of the disease is more rapid than compared to the older age.
And what is robotic surgery, and what are the benefits of robotic surgery in the prostate cancers?
In the prostate cancer surgery, we have 3 aims. We usually define is 3 factors. Our first major aim is to rescue the patient from the cancer. For that reason, we are trying to clear every prostate cancer cells from the body. But prostate is located in the deep part of the body, and it is very close relation with the muscles that helps urinary continence. And
so you mean that urinary incontinence may occur after the
yes,
cancer?
After the prostate cancer surgeries, there are 2 main complications. The first one is the urinary incontinence, and if urinary incontinence occurs after the operation, the quality of life of the patient deteriorates seriously. The second important complication, it is also more important for younger people, it is erectile dysfunction. And of course, if the man loses their sexual life, this kind of man tends to depression more than the healthy ones. We know that. For that reason,
quality of life, you mean?
Decreases. So as a surgeon, the aim of ours is keep all the important tissues around the prostate. So we work as close as possible to the close to the prostate, but on the other hand, we try to work as far as available in order not to leave any cancer cell around the prostate. So this means that this is very thin line. You work on very thin line, but this is surgery, of course, with experience, especially if a surgeon is skillful, he is adapt with the new technology, robotic surgery. After 100 or 200 cases, a surgeon can do this job very well. Of course, it depends on the surgeon's skill. Of course, 2 or 3 surgeons
you mean the robotic, it is called robotic surgery, but the surgeon does the operation.
Yes, the surgeon does the operation. Robotic surgery system is just a tool. The surgeon makes it a Da Vinci.
So thank you for these informations, and I want to ask, how will our patients will reach to you? Where is your hospital? Which city? Which country?
I'm living in Istanbul, Turkey. Maybe you have to ask me why people has to select Istanbul and you, because in Turkey and in Istanbul there are many skillful doctors, and I am one of them. Secondly, we do the state-of-the-art surgeries. What is done in United States can be done here, and with achieving very successful results and very low complication rates. Secondly, Istanbul is a very beautiful city.
Yes.
During the treatment period, the patient and their family will have the chance to live in Istanbul.
And I want to ask, sorry for interrupting you, but I want to ask another important question. How many days do patients have to stay at the hospital during the surgery period?
I am usually focused on uro-oncology and urinary stone disease for that reason.
For example, for robotic surgery.
For robotic surgery, for prostate cancer, of course. Usually,
of course, it depends on the patients.
Of course, it depends on the patients. It depends on the patient's bowel movements. But as you know,
in normal conditions, for example.
In normal conditions, 99% of my patients discharge from the hospital on the second or third postoperative day, and we send them with walking, and they go around.
Istanbul.
They have a meal near the Bosphorus, and after a couple of days, I again give them a appointment and check the results of the operation, and then send them to their country.
So, in which hospital do you do your operations?
I do my operations at Şişli Memorial Hospital.
Private.
It's a private hospital, very comfortable. We have all the new technological equipments, very clean, very sterile, very new hospital. So I invite all of them in Istanbul.
Thank you.